Well, if you remember how the whole mask discussion started, it sounded a lot like this a couple of months ago.
Medical masks like this one cannot protect against the new coronavirus when used alone.
Right now in the United States, people should not be walking around with masks. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
A surgical mask, let's start with that one, does not protect you from from a respiratory virus. It's got leaks all around it, and it's really designed as a barrier protection for people in the operating room. That's why they call it a surgical mask. The N95, which is the one that people are buying up, important also to understand that that N95 mask, I have to be fit tested for it. I've got to make sure I've got a tight seal to wear it as a healthcare provider. The average person out there, the average citizen, that mask is not going to protect them. And as a matter of fact, in most cases, they're actually going to increase their risk of being contaminated with a virus when they're wearing that mask improperly, because they tend to touch their face, they tend to move it around. It's very uncomfortable, it's hard to breathe in. Not only are you not preventing yourself from getting a disease, you may be increasing your chance of getting a disease by wearing that mask.